Genesis is joining us this morning. Thanks for coming from Nirvana Laser Hair and Skin Clinic. We go to the doctor nowadays and we see these large posters up sometimes, often showing celebrities, about different pharmaceuticals out there that can help us cosmetically. And one I've been noticing, and I also have a lot of questions about, is something called Latisse. It's for our eyelashes to help them grow. And there's a neat backstory, Dr. Genesis, in terms of how this drug was discovered.
It's serendipitously. It's often the case with many of the pharmaceuticals. We discovered that the side effect is equally as beneficial as the original intended indication. And the same here with this medication. It was used for glaucoma. I think it was approved in 2001, so we've had quite a few years now, 12 years or so, of application in the wide public of North America. And it's proven itself excellent for glaucoma, but people realized, or the pharmacists in particular, were the first to notice that every time the renewal for the medication came, that the eyelashes were getting longer.
So glaucoma patients being treated for this, were growing these long, thick, lush lashes. And Latisse is something that many women are choosing as an alternative to these eyelash extensions or even mascara.
Correct, yes. I think it's a natural and easy method that probably costs less and perhaps equally safe.
Right. So just quickly, how is it administered and how exactly does it work, Dr. Genesis?
Well, as far as how it works, it increases the duration of the growth phase of the hair follicles. So hair is either growing or it's dormant. And if you can encourage the hair to grow long, then the hair grows long. And when it goes dormant, the hair sloughs out. So if you have short growth, you have short hair. If you have long growth, you have long hair.
So it's kind of extends the life of each lash.
Correct, yes.
Okay.
The growth length, the duration, and that correlates with the length of the hair.
Right. And it's something that people are using at nighttime?
Yes. Very easy. When you brush your teeth, you can simply make application just once a day to the lash base.
Now, I personally, I'm always hesitant. If it's something I'm putting on my eye or in my eye, I'm going to be a little bit leery of it. Side effects?
There's no medication without any side effects, but it has the assurance of wide application for about 12 years in the public. And so we're very clear that we know what the side effect profile is, and it's very safe. It's been considered a very safe medication for glaucoma. And in this case, we're not putting it in the eye, we're putting it on the skin.
Right.
And so we can expect the side effect profile would be diminished compared to that of glaucoma, which was already recognized as a safe medication.
And I was doing a little bit of reading online on it, and I noticed one of the other side effects is darkening of the lid where you're applying it, or even the pigment itself. And one of the spokespeople for this is Claire Danes. And I noticed even on her, she got some of the lid darkening. With the patients that you've been treating, have they been seeing this? And do they see it as a fair compromise to what they're experiencing in terms of positive effects on their lashes themselves?
Well, the vast majority of people experience quite a dramatic improvement in the length and the caliber and the darkness of their lashes. So efficacy-wise, no problem.
Right.
And as far as side effects are concerned, I'm one practitioner who is not it's not big numbers. Really what we should be referring to, my patients, we should be referring to the scientific studies. And the rate of hyperpigmentation around the skin of the eye is about 2%.
Okay, so the hyperpigmentation side effect is a smaller one.
Right, and if it happened, you simply discontinue and it disappears. There is another side effect of pigmentation of the colored portion of your eyeball, your eye.
That sounds scary.
It is.
Yeah.
It's something that doesn't happen very often with the eyelash application. And if you use the medication in the eye for glaucoma, you have a higher rate of it. and even that is very slow onset and very small rate.
Right.
Yeah, so it doesn't seem to be an often event, and if it does occur, it might change the eye from blue to green, or it might make the eye hazel to brown, or brown to browner.
Right. It's interesting to read up and talk to people like you who are knowledgeable about it. Dr. Rose Genesis from Nirvana, thanks so much for coming in today. Laserhairandskinclinic.ca if you'd like more information. We see these posters and it sparks these questions, so it's nice to have some insight. Thank you.
Thank you, Lisa. Bye-bye.
The morning news continues just ahead of 8:30.